So there are two main incubation methods for embryos in an embryology lab. One is a standard benchtop incubator, and the other one is an incubator with a camera called time-lapse incubator. The advantage of the latter is that images are taken every 10, 15 minutes, such that the embryologist actually has access to a few hundred images that represents the development of the embryo throughout a few day development or culture process. So what Chloe does, it connects to these time-lapse incubators, acquires the images, and then analyzes each of them to not only see what the shape looks like, but how it changed from the previous. So it measures things like timing, and it understands, very subtle morphological changes and knows how to associate them with quality such that as the embryo develops in time, the confidence in this score and the ability to say, this is, an accurate score increases. And the clinical studies that we performed, in this case in the FDA, showed that it's very consistent because it's a computer. It's not a human ranking, one day this, one day that. And it is more accurate in the sense that it automatically knows how to detect the higher quality embryos relative to an average embryologist.
And the studies you've done, can you give me the top line, takeaway or metric that, again, how much better is it than traditional or current practices?
So there are many ways of measuring this. In our case, what we look at is time to pregnancy. Okay, so when you basically have a ranking problem or challenge, how fast can you identify the right embryo, right? If you have five embryos and you transferred one, two, three, four, five, it would take you five times more than if you hit it on the first time.
Mm-hmm.
So the studies that we conduct with customers, it's not necessarily what the FDA clearance study was based on. Shows, depending on the workflow, 20 and sometimes even more percent improvement in time to pregnancy. So that's quite significant.